I had back-to-back visits with my primary care physician and my oncology team. So it's a lot to unpack here, but I'm going to do my best to make it as concise as I can. So, welcome everyone to my channel. My name is Chad Royer, or let me correct myself, Chad Y. Royer. Yes, the Y is important. And this is my channel, What's Up with Chad Y. Royer, and I discuss my journey as a cancer patient and a cancer survivor having dealt with multiple myeloma. So, for those who haven't done so, please feel free to share the videos that I have, subscribe to my channel, like the videos, feel free to leave comments, and let's get started. So, I want to, this is actually off topic. I want to thank my doctor, my primary care physician, Dr. Sandra Hall Ross. I want to thank her because it was because she saw the signs that I probably needed a second look at the blood work, and she was able to organize an ER visit by ambulance that got me from home to the ER, where the ER was able to take me from the ER to the oncology team. I want to thank her because if that situation was delayed, my progress could have been delayed or it could have been different. I credit her, among a few people, for saving my life. And I also credit a lot of people in my corner for standing by me and helping me fight this disease called multiple myeloma. So, Dr. Hall Ross, I am forever grateful. Thank you. Thank you. Now, let's start with why I had back-to-back doctor visits. The number one reason, it was insurance related. I wanted to make sure that I was able to have the visits covered by the insurance before there was any type of lapse in coverage or out-of-network coverage. And also, the way that my primary care visits were set, it would have been every January to fall into a year. Last January couldn't happen. No, scratch that. January of last year couldn't happen, so it had to be February. So that's why February was the earliest that I was able to have my annual visit just to check up on some things. And I'll just mention, I asked about any kind of milestones that I need to be looking out for. So I'm waiting to see what the PSA results are, because a lot of people are surprised when their PSA isn't out of range, and then they have to act on prevention plans or action plans. Also, I explained what was happening with the treatments that I've been getting, just to keep her up to speed with everything. And I find that's very important because, let's say the oncology team was a disaster. Let's say they were. I still have my primary care physician, and then at least she would have been in a position to make some phone calls, to make some recommendations that can probably help my situation. And also, it helps to update the charts. Now, another thing, she also made some recommendations on the meds. So I got to be careful on how I take some of the meds such that my body doesn't become dependent on the meds in order to do the stuff that is normal or expected. So that was very, very, very good. Not to mention that the numbers, everything looked good at this time after what I've been through. So, that was why this appointment was very important, because I still need a resource outside of oncology on things to do. She's not necessarily an expert in oncology. Oncology is not necessarily an expert on primary care. So that's why I need both of them. Now, let's cover the next topic on my mind. There's a few of them I said. My bone marrow biopsy that I had to do recently. So the reason why I had to do the bone marrow biopsy a second time is when the doctors in oncology are looking to see if there's any cancer remaining in the system. MRD negative would show 0 detected cancer cells in the body. Anything higher than that would mean that there's some cancer remaining. That's a test that is done where if the highly sensitive test cannot detect anything, that can determine someone's cancer-free levels. So in August of last year, I announced to the world that I was MRD negative. From this recent bone marrow biopsy, I am also still MRD negative. So now that I have been MRD negative 2 tests in a row, I am what's known as having sustained MRD negativity. Sustained MRD negativity. So now the next steps, and this is good. This is really good. So the next steps would have to be my tolerance level or my willingness to withdraw from the drugs that I'm taking. That's a future conversation. I hope it happens sooner than later, but I will keep you posted because that is a hot topic. It is for me and some folks who I know. I'm going to lean on the side of getting off the drugs if I don't have to be on them so I can avoid the side effects. Now, what else is on the agenda? I also had to take vaccines. Again, I had to get vaccinated because when I had the stem cell transplants, a lot of my vaccines were wiped out. My immunity was reset down to 0. And what I learned is that since, I didn't tell you this, by the way, since I had taken time for quarantine in April up until July, even though I passed the quarantine period, even up to now, my immunity is not 100%. So you may not notice, but I was again under the weather this past weekend. So approximately 5 days, I was under the weather with a head cold, heavy phlegm, coughing, blowing my nose. It will take me longer to get over those symptoms and perhaps any other symptoms because of my immunity not being 100%. We could be looking at, trying to look at the calendar here. I would have until March or April to be as close to 100% immunity from having gone through the not the bone marrow. I'm getting so many things I went through. The stem cell transplant and the heavy dose of chemo that I had to do, which caused me to lose my long hair. By the way, it's doing its best to come back. So some of the vaccines that I had to take 6 of them. And this is my second round of vaccines that I had to take because even though I take them all at once, I still have to take some of those vaccines a second time. So, what do I start with? Shingles. I had to take shingles. I'm just going to read off this straight from the CDC. I said shingles, right? Yeah. Let's go in the order that I had this. Shingles. Why get vaccinated? Shingles is painful, skin rash, usually with blisters. It can cause fever, headache, chills, upset stomach, and the risk of shingles increases with age. Tdap. Tetanus, diphtheria, and pertussis. So the Tdap vaccine prevents those three things: pertussis, whooping cough, tetanus, I can't say that word properly, causes painful stiffening of the muscles, can lead to serious health problems. Diphtheria can lead to difficulty breathing, heart failure, paralysis, or even death. Here's one for you. The HIB, influenza type B, or Haemophilus influenza type B. So what the HIB infection can cause: pneumonia, severe swelling in the throat, infections of the blood, joints, bones, and covering of the heart, and they also say death. Hepatitis B vaccine. Hepatitis B vaccine. So hepatitis B is a liver disease that causes mild illness lasting a few weeks, but it can also lead to serious lifelong illness. There's chronic and there's acute. Pneumococcal conjugate vaccine. It's a long word there. So the pneumococcal bacteria can cause many illnesses just like ear infections, sinus infections, meningitis, pneumonia, among other things. And the other one that I had to take was the polio vaccine. I had to take the polio vaccine. Now, polio, short for poliomyelitis, disabling and life-threatening disease caused by the polio virus, which can infect a person's spinal cord, leading to paralysis. I had to get those shots again in my shoulders, and they are still a little bit sore as of today. But the first 2 days since having gotten the shots, I got them all at the same time. I was having some challenges moving my arms. It was very, very sore. But I'm going to be okay. I've been through it before, having taken the shots at the same time. After a few days, it got manageable. So I figured if I was able to do it before, I can do it again. This might not be the same for everybody else, as everyone else's tolerance level is not the same. Now, I am at the end of my video, but I just want to make mention of one thing here. We've had a lot of freezing weather in the Northeast and the Midwest, and even down Florida and Alabama and Texas. I attribute to some of my issues directly because of the freezing cold weather. And the freezing cold weather, and I'm finding this out for the first time pretty much, it affects the bones. it affects the joints, and in my case, it caused me not to be able to relax as much as I wanted to. I'm not sure if that's common a common thing for anyone who's dealt with a cancer diagnosis, but for me, the extreme cold, I'm not able to relax very well unless I am warm and comfortable. But just sharing that. I'm just hoping that as the snow is melting right now, I believe it's like 34. Uh, the temperature at melting point is at freezing point is 32 degrees on the Fahrenheit scale. Let that snow continue to melt. I'm done with it. I'm done with it. But anyway, I'm going to end this video right now. Thank you for listening. Please remember to share my video with folks who you know and even folks who you don't know. I tell my story as a cancer patient and a cancer survivor, and I'm hoping my story can help someone you know or someone that you don't know. You be safe. You be well.